Africa has the largest number of people living with HIV and AIDS. Close to 26 million people are infected as of 2018, according to the World Health Organization. And every year, projected 1.1 million new infections are recorded. Just about the same number of children and adults die of AIDS and or its attendant diseases annually. Now, Africa's fight against the disease is mainly donor-funded and concentrated in the south and eastern parts of the continent where prevalence is higher. In fact, 2 decades ago, the UN predicted that half of the teenagers in southern Africa will face early deaths because of AIDS. Today, the story is different, thanks to extensive education and improved preventive care and treatment. However, the fight is far from over. According to global health leaders, Africa's progress is still checkered, and that's why they're calling for inclusion and equality in the strategies employed to combat the spread. So I ask, what's your HIV/AIDS status? When was the last time you were tested? Thank you so much for joining the gathering at the square today. I'm Keminni Amanor. Let's now meet our guests. First, we have Steve Aborisade. He's Advocacy and Marketing Manager at AIDS Healthcare Foundation in Nigeria. We also have Alex Ogundipe, who is Director for Community Prevention and Care Services at the National Agency for the Control of AIDS, also in Nigeria. Gentlemen, you're welcome to the square.
Thank you.
Great. Now, I want to start with you, Alex. What do you think about the fight so far? Is Africa losing or winning the fight against HIV and AIDS?
Thank you very much, and thank you for inviting us, and thank you for the topic that you are focused on, particularly in this period when we are commemorating the World AIDS Week and Day, which seeks to honor the memories of those who have lost their lives, unfortunately, to this pandemic, as well as celebrate governments, communities, and stakeholders that have in one way or the other contributed to getting us to where we are presently. It's Africa, so the question is, how are we doing? I think with all the support we have gotten, we are getting close there. There's significant advancement in science, in researches, in bringing services from prevention to treatment to caring for people who are infected and affected. We are making great strides. In spite of even the recent COVID pandemic, we were advancing very significantly.
Very well.
And case in question is Nigeria. Of the 1.79 million persons that are projected to be infected based on our survey, population survey of 2018, about 1.7 of them are currently on treatment. However, with significant gaps, while we have just about 200,000 to enroll on treatment, because we do believe that if we can find everybody that is infected and place them on the life-saving antiretroviral drugs, and they continue to use their drugs conscientiously, we will be able to suppress the virus and they will become virally suppressed. If they become virally suppressed, it's been proven severally that they will not be in a position to transmit the virus to anyone.
Very well.
Now,
we'll talk a bit more. We'll talk a bit more about what has contributed to the progress that you spoke about. But let me also hear the thoughts of Steve, who's also been on the Zoom. Steve, where do we stand as far as the fight against HIV/AIDS is concerned?
I think there are so many things to be thankful for. We must thank the government of Nigeria. We must thank our international partners who have supported the efforts to combat HIV/AIDS in Nigeria. Right now in the country, we have an environment of treatment success. A lot of people are living very well, lives, they've gotten back their life, and they are very hopeful. And as I talk to you now, HIV/AIDS is no longer a death sentence, as we used to know then. Now you can do whatever you want to do. There is life just ahead of you if you just embrace treatment.
Very well.
Right now, we are, like my colleague said, if you are on treatment, you are unable to transmit that virus to another person. If you are on treatment and you are a mother, you have the possibility of not giving your child the HIV virus. We have couples, both HIV positive, having children who are now negative. These are the good news. These are the good news. All right, and it's incredible what science, what the effort in terms of funding has been able to achieve. But there are still challenges.
Yes, I will talk about those challenges, but first, I want us to understand why, even though we have massive progress in the fight against HIV and AIDS spread on the continent, the result is not the same. Alex, can you help us with an explanation as to why that is so?
Thank you very much. The reason, and that is why the theme for this year is about equalizing access to prevention and to treatment. For Nigeria, that is what we have adopted, that how can we remove the barriers? And these barriers, they vary. One, we've got environmental policy legislative barriers, which, like every other African country, we are very religious in Africa. And so we tend to criminalize same-sex couples, gays, and key populations for their life choices, rather than look at the public health and look at what their needs are as their right as individuals. That is one of the environment, the legislative environment that we do need to pay attention to, and is creating unnecessary barriers to us providing access to prevention, care, and treatment. Another of the barriers that exist is that majority of the responses across Africa are funded essentially by donor partners from across the world. It endangers our response and the successes we have because we've not been able to domesticate funding either from government, the private sector, or subnational governments in our country. It puts our success at risk, at great risk, because should anything happen to the present flow of resources, then we will all be in for it. And finally, if I may put this, majority of the drugs available that these individuals are swallowing, sincerely, they are manufactured not in Africa. They are manufactured from outside Africa. We do need to domesticate the manufacturing. Then the cost of the response will come down significantly. But because of the lack of capacity and infrastructure across most countries in Africa, it's unfortunate. The cost of getting these drugs, even though they are donor funded, it's still exorbitant. Until we domesticate this, unless we domesticate our financing, unless we attend to the environmental issues, unless we make the legislative environment better and more accommodating and less stigmatizing, we might have a rebound across Africa in a short while.
Well, so I want us to look at the bit about inequality. Three things you mentioned that I want us to look at. Steve, we hardly speak of our queer community, particularly in many parts of the continent. And I just want you to help us understand why it is significant, it is important for us to involve our queer communities in the fight against HIV and AIDS. Steve.
What community?
Our LGBTQ communities.
There's actually intervention for the LGBTQ community, especially here in Nigeria. There's a KPIS secretariat, which is part of the national intervention, we cater to them, and services are actually around. Of course, we know the cultural and social barriers that the members of the LGBT community have, which is not just in Nigeria, it's everywhere in Africa because of our culture, all right? But there is definitely intervention for HIV/AIDS to that community, not just to the LGBT community, even to the community of people who indulge in sex work. You know, we have kind of a robust intervention in place. Like my colleague just said, the challenge as the inequality can be related. When you look at distance, sometimes you go to some states. For individuals in the remote villages to access treatment is a big deal. And for instance, look at the issue of COVID-19. With the vaccines have to be brought from abroad. We're not manufacturing here. I doubt there's any Nigerian pharmaceutical company producing ARVs. Everything has to come from abroad. So these are the challenges we are talking about. Then we have issues with young people as well, because young people, that's a population that needs special attention. The funding is not really there, because for instance, without the support of our global partners, it will be very difficult. Government is trying its best, but we still need more. That's why we're even calling on the private sector. An AIDS trust fund recently was initiated. We hope the private sector in Nigeria can, embrace that, support that funding, and support the system.
But Steve, so here's my question: how easy is it? Yes. And Alex, I'll come to you with the same question. How easy is it for the vulnerable, for instance, people who identify as LGBTQ, sex workers, people who inject drugs because they suffer from drug addiction? How easy is it for them to access interventions meant for people who have HIV or AIDS, given, the cultural stigma that comes with it?
So one way that we have bridged that gap is to have some CSOs, civil society organizations, who, focus mainly on that community. And some of these CSOs are even manned by members of that community themselves. But I am certain there is no health facility in Nigeria that will reject anyone or whichever community you belong to. That's a reality. I'm not saying there is no stigmatization. I'm not saying there are no issues. There are, and there are issues everywhere. But if you are a member of the LGBT community, you have access to intervention. Because we have peer-led intervention. We have group-led intervention by members of that community themselves. So there's actually access. What is the major problem is the acceptability by Nigerians themselves, which is basically an issue of culture.
And it's not only in Nigeria, Alex, but Alex, share with us some of the interventions that exist in Nigeria to make HIV medicines and preventive medicines accessible to the vulnerable communities.
Thank you very much. And I think that is one of our success area in Nigeria presently, because we are more and more recognizing that it's an uphill task to change legislations and the legal policy environment. We at the national agency and with stakeholders, we've been pushing for a recognition that we see HIV more from the perspective of public health threat. And as such, we reach out to these communities to domesticate service delivery within the community. And some of these initiatives, by thinking out of the box, we recognize stigmas that are present in facilities, healthcare facilities across the country. We do not deny it. It is difficult to change people's religious perspective and their attitude, but there are a lot of capacity building and training to turn such places to youth-friendly centers that LGBT community members are not stigmatized. But the other thing we are doing is to take services into these communities themselves and to make members of the communities part of the service delivery mechanism and healthcare workers that are delivering services. They are less stigmatizing. and we scored a lot of successes during the lockdowns of COVID.
All right. So speaking of going to the communities, talk to us about how conflicts in certain areas have made it difficult for you to, or otherwise, I never know, for you to reach people in those areas.
That's another of the barriers that we've gotten in areas where there are banditries, that there are the Boko Haram menace has been. While health workers and healthcare facilities have been shut down, or even where situations where there were flooding that was widely reported and covered across the country, while those existed, the fact that we were using the community members themselves to deliver services, to reach their members, to restock their drugs, and to carry out testing and education amongst them, did not allow interruption of services. And that's why we have this high level of degree of success in having at least and retaining up to 1.7 million of the 1.9 million Nigerians that are infected. That's one of the reasons. So that's why in recommending is that by thinking out of the box and taking services out of facilities into communities, using community members of the LGBT, as well as even PM in delivering mother-to-child interventions through mentor mothers. That is, women who have been who are infected, who are on treatment, who have been successful in bearing children without being infected, using them to reach out to other pregnant women. And that's what we call the mentor mother model. We have recorded tremendous success using this, and we encourage other people to do this because it's the way to go. Thank you.
I'll come back to you and we'll talk about that success. But Steve, talk to us about PrEP. How available is it in the country? How available is it on the continent, if you have that knowledge?
It's available to, the issue with PrEP is its affordability. This is what we say, for instance, there's ARV, okay? There's ARV, and there's condom, which we are, marketing and encouraging people to use. And we are complaining right now that there are no Nigerian companies manufacturing ARVs. PrEP is also a way to prevent HIV/AIDS, all right? And but the focus of government is basically on the ARVs, all right? So why not we focus on that and ensure that every Nigerian have access, universal access, because of course we're saying that the funding is not really available. So, but there are PrEP, available to specific communities, especially the LGBT community, but it's not widely available to the population. And this is just simply because, it's better, is money-wise, all right, to focus on ARVs, to focus on condom prevention, and instead of, because PrEP is actually very expensive, and that's the reality, okay? So, that is the policy environment.
So before we take that question to Alex and ask Alex, what's happening with the prophylaxis, talk to us, Steve, about how important PrEP is and what PrEP is really.
So basically, let me tell you one thing. PrEP and ARVs, the ARVs is what we use to treat the virus. All right, PrEP, especially if you have a wife who is HIV positive, or people who are engaging in anal sex, you have your partners. You can if you take PrEP, the possibility of contracting HIV is reduced. All right, you can eliminate it. All right, but it's not really readily available, and I'm not sure the country can actually afford it.
Let's find out why. And Alex, correct me if I'm wrong. PrEP has been around in Nigeria for a bit. What's left is the education to understand what it is. But talk to us about what NACA is doing about PrEP.
Thank you very much. NACA's role is to coordinate as well as set the policy environment and get stakeholders and funding into particular program area as as enunciated in our national strategic plans. Now, on the PrEP that you have mentioned, the challenges with PrEP is to get it to scale. One, it is also to get it to be readily available out there, that apart from through public health programs that people can walk in, people who know that they're about to engage in risky behaviors or challenging situations that could lead to the transmission of HIV, for them to make the move. Condom is readily available. It is the ARVs, antiretroviral drugs, that are the other components of the PrEP package that is not readily available because they are subsidized. They are not just subsidized, they are fully 100% funded, with more than 90% of the funding coming from donor partners. And so it is targeted.
Yes,
so those who are on treatment for now.
Well, so that's what I want to find out, because we know that only about 3 years ago, the U.S. PEPFAR released funds towards the purchase of PrEP, particularly for Nigeria, and so PrEP naturally should come free.
Maybe you are talking about PEP. There is PEP, which is readily available in all facilities across Nigeria.
Well, good. So what's the difference between the PEP and PrEP? Because I assumed they were the same.
PEP is post-exposure prophylaxis. When you feel that you are exposed, for instance, a child who was raped, a girl who was raped, before, and if you approach the facility for intervention, they administer PEP on you. It reduces the chances of you getting infected with HIV. It's different from PrEP. PrEP is, you are going to engage in a risky behavior. You probably have a partner who is HIV positive, and you are having unprotected sex. But it is not affordable. It is not realistic for countries in Africa, Nigeria, to say, okay, we are going to be supplying PrEP like we are supplying ARVs. This thing costs a lot of money.
So, gentlemen, I want us to talk about how we can make that easily available, how we can also educate people more on PEP and PrEP, both of them, when we come back. So stay with us here on The Square. Welcome back to The Square. Today we are discussing Africa's response so far to the HIV and AIDS epidemic, and the areas where we can improve our strategies. And still with me are Steve Aborisade and Alex Ogundipe. Both of them are joining us from Nigeria, and we have been having a pleasant conversation about this. Steve, you ended our conversation, so let me go to Alex maybe now. Alex, tell us how we can make this affordable, PrEP affordable, PEP very available and accessible to the people of Nigeria.
The main idea is to increase funding to HIV/AIDS, and that's what we've been talking about. It's to ensure that other stakeholders, come into HIV/AIDS. We have the private sector who have not really been participating. They really now need to participate. Our state governments need to join the federal government to commit funding to HIV/AIDS. That's the reality. Because basically what we rely on is what we get from international donors and the federal government. The state governments, they are trying, but they really need to do a lot. So if we have support from the private sector, we have support from state governments, coupled with what we are getting from international donors and federal government, I believe we will be able to afford, these medication services.
Alex is back. Let's hear from Alex. Alex, does NACA have any ideas as to how to make this really important preventive drug available to the people of Nigeria?
So we are pursuing two tracks. One is less dependency on donor partners to bring in drugs. We are also pursuing local manufacture. If we can get local manufacturing started in this country, then we will not be spending and needing as much resources as we are presently depending on the partners for. So we've been speaking to majority of the manufacturers of ARV to come and set up shop, particularly in Nigeria, because we've got a large market and there's proximity to other African markets right from Nigeria. So we are pushing that track, and the federal government initiative has started the HIV Trust Fund, which seeks to raise about 15 million US dollars to support the fight against HIV in the country. So if we are in a position to achieve those two, then we might be able to get more resources into the fight, as well as devote more resources to PrEP. There is something that we did with condom. In the 90s, condom used to be solely public health distributed, donor funded. But now, about 70% of the condom market is social marketing. The private sector is fully involved. While there is no manufacturing as such, but the private sector brings in condom and people buy condom and there's less than 20-30% of the condom in Nigerian hands that is just public health sector. If we can grow on that tangent, then we will be in a position. The moment that PrEP commodities can be bought in the pharmacies by individuals who know their risk or the action they're about to take that is risky, and as well as PrEP, then we will have taken this fight further. But for now, donors are only interested in funding the treatment components.
I wonder why. Have you ever wondered why, there seem to be bigger interest in treating the disease when the person has already got it than preventing it? Has it ever crossed your mind, Alex?
Yeah, because it's just like politicians as well. See, politicians like to build bridges, build schools, rather than to do the other interventions that looks at the human capital development. They like to spend money on what they can count, what they can see. For the American government, they are supporting about 14 countries. PEPFAR is in about 14 countries. They want to count the number of people they are placing on treatment rather than the number of lives that they have saved by preventing them from contracting HIV.
So then it brings me to my question, Alex. I apologize for rushing you. It brings me to my question.
No.
How is South Africa doing differently? Because PrEP, the preventive drug, is very available in South Africa. What is different about that example that, West African countries can learn? Because in places like Ghana, it's zero over there. You cannot find PEP or PrEP anywhere in Ghana.
I'll give you an example. I'll tell you what South Africa did that is so unique, and no other country that has this kind of burden has done it. South Africa's resources by itself into the fight against HIV and for treatment is heavy. Their investment, there was a year that they themselves from the treasury placed about $2 billion to procure commodities for their response. We don't have such response in West Africa, not even Nigeria. Nigeria tries, but what Nigeria puts in is still in the millions, is in the lower millions, not even 100 million. But South Africa took the bull by the horn and put in about $2 billion to purchase this thing. So you can see that the attitude in South Africa, and where you put your money, then you can determine what it is.
Right.
While it is good to have PrEP commodities out there, but because Nigeria is not spending as much money to do this, it's difficult for it to direct the partners that this is where you put the money. They will put their money, it's their taxpayers, and they will rather choose where they can be accountable.
I'll come back to you, Alex. Let's talk to Steve now. Steve, talk to us about who can access PEP and how they can access PEP. At least that is widely available in Nigeria for free.
Yeah, for totally free. Anyone who is at risk of HIV infection, victims of sexual violence, basically anyone, PrEP is readily available and is free. Just walk into any facility, wherever you are, and ask, to be served PrEP. Although they will have to first of all test you for HIV before, administering PrEP. But it is available. And like what we are saying, that is it's about priority, actually. It's about priority. When we are proud, we say just to prevent HIV/AIDS, we have condoms. And we have, it's not as if we have unlimited source of funding. We have a funding stream that is limited. So we have to prioritize. We have condom that can prevent HIV/AIDS. We have even the behavioral component, if you abstain, that can prevent HIV/AIDS. And for the people who are already HIV positive, why not we prioritize treating them? That's the issue about PrEP that you raised earlier on. Why are we not prioritizing treating those people? And that's exactly what is happening here. All right. If our government, for instance, if our private sector, if the state governments, put in more money into the intervention, we'll be able to do what South Africa is doing. In South Africa, they have universal coverage. Universal coverage. All right. Yes. And it's because the local governments in South Africa is putting more money into HIV/AIDS.
So here's my question to you, Steve. Steve, yes. How can we restructure, particularly those of us here in West Africa, how can we restructure our public health systems to make it easy for people who have HIV and AIDS, people who think they may be exposed to an infection, are prioritized, in the process of healthcare delivery? How can that happen in our public health systems?
They are being prioritized. I have to be sincere with you. They are being prioritized. Government is putting, from the limit of what it has. It's being prioritized. When we talk about HIV, you cannot look at other public health issues. You talk of malaria. We've not even been able to deal with malaria. All right. We have so many public health issues. All right. So I don't know what limits government can do, but I think the government is trying. What is really needed, it's not just government now. The private sector, that's what is happening elsewhere. The private sector, the state government, the local government must come in. Without that, there's nowhere where we're going. We won't be able to achieve much. The funding must improve from what we have. And the only way we can improve is when we have more partners, more participants, putting money into that fund. That's the only thing. All right. Again, we've had a lot of awareness, and we have to keep on letting people be aware. That's another thing. As I talk to you now, several thousands of Nigerians are yet to know their HIV status. That is reality. Another thousands, millions who knows their HIV status are afraid to go to the facility to embrace treatment because of stigma. All right. So at the societal level, we have to be able to fight stigma too. We have to realize that the current science of HIV have resolved the issue for all. HIV is no longer a death sentence. You can live your life. You can be happy. You can do things. Now, employers are not hiring you because if you're HIV positive. That is wrong. The right environment needs to be strengthened. That's another thing that must be done. And it's not just government now. It's all of us. The media must also, play its role. You don't focus on HIV/AIDS only when it's World AIDS Day. It has to be that there must be an in-house policy by every media organization. How do we report HIV/AIDS? What level of information are we passing on to the people? It has to be consistent. It has to be consistent. All of us will have to play a role. That's just it.
Well, so speaking of funding, I want us to look at funding just over the next few minutes. Alex, you mentioned the trust fund when you were commenting earlier. This trust fund was established 2 years ago. So what is the state of the trust fund? Is it working?
And it is working, and it primarily targets the blue chip companies to bring in resources. But on the World AIDS Day for this year, on the 1st of December, a popular platform was launched that enables the average Nigerian philanthropist to join in and chip in little resources targeted at whether you want to support 1 testing or 10 testing or 100 testing, or to support X number of pregnant women to know their status and to be protected against transmitting the virus to them, or to even treat an individual. To treat an individual was costed at about 50,000 naira per annum, and it brings it closer to receiving resources just like campaign contributions from Nigeria. Yes, we don't yet have as much success, but we know that it will grow and it will get better. Of course, you can't compare the population in South Africa to the population of Nigeria. Yes, you can't compare that, and you cannot compare the South African economy also with that of Nigeria. Those are big challenges. When you slam our population against our GDP, while we might have a better GDP than South Africa, South Africa is way up because it has lower population, and that does not put pressure. There's so much the government needs to do. There are other public health challenges that it has, and that is why the resource flow into HIV fight is actually a challenge.
Very well. So talk to us about this new platform, and if corporate organizations would want to pitch in, how can they help?
We've got the HIV/AIDS fund. I wish I could share with you the website, how to log into it, but it's just a popular website that you could just log onto the website, and with your card, you could just be a donor to any of this. I will share that with you, with your team after this.
All right, finally, how much do we have in the fund right now?
Right now, we have commitments to the tune of almost about $7 million.
That is below the target when it was set out 2 years ago, isn't it?
Yes, because the reason is, to get the private, to rev up the private, and it's totally managed by the private sector itself. What NACA does, NACA sits on the same board, but only as advisory capacity to guide in the technical application. So what we do is, with our partners, we identify which areas we would like them to fund, like what quantity of drugs they need to supply into which drug, what time they need to bring it in. And by their system, they commission and they bring in the drugs and just hand it over to us, and we put it in the pool along with the national cost quantification of what is needed for the response as appropriate.
Very well.
As of now, they are focused on supporting the preventing mother-to-child transmission commodities.
I wish we had a lot more time to talk about, the challenges that NACA faces, as it tries to reach all of the parts of the country. But unfortunately, this is all time will allow for a discussion today on HIV and AIDS. But like Steve said, we hope to pick it up again in the future, hopefully not when it's World AIDS Day. Right, Steve? I can't hear you, but I understand what you're saying. Gentlemen.
That is right. We have to make it like an in-house policy thing. HIV must be priority coverage for every media organizations.
I understand. And thank you, gentlemen, for joining us today on The Square. It was an absolutely insightful conversation.
Thank you.
Thank you.
Alex Ogundipe there, and Steve Aborisade also joined us on this conversation. Get tested. Know your status. Remember, there is PEP at the public hospital for you. If you feel you have been exposed to HIV or AIDS, go get it. Forget about the stigma and live long for News Central. My name is Keminni Amanor. Goodbye.